Let me introduce Shiny. Shiny has been a great friend. Shiny and Surendran are family friends. She's a very reputed, hotshot sports nutritionist working out of Chennai, known very well nationally and internationally. So any of my patients, friends who need any advice on diet, fitness, nutrition, she's the go-to person. So she's got an enormous practice, and she technically is the go-to person in Chennai for good advice on what you eat and how to stay fit. So welcome to the show, Shiny. And she's got a big CV, which she's got a very big CV. I'm not going to go through it. It's all available on online for people to check. But if you need to contact her, she's from Chennai. Anyway, good. So let's get this thing started. So what is a good diet? What do you mean? What do people understand by diet?
Okay, the US has a food plate. Yeah, so that's the basic standard that we follow. And even in National Institute of Nutrition, they always advocate about how to eat certain. Keep it very simple, we need to eat a variety, and our food plate should definitely have half a plate full of vegetables a day, so that we get our daily dose of vitamins, minerals, and fiber. So that is one aspect. The other half of the plate should be filled with grains and some protein source. It could either be a plant source or it could be an animal source. Okay, and of course you need liquids, that's water, or it could be rasam, buttermilk, because not drinking adequate water itself is a big problem, and that's why people come to you, right, when they have constipation or any kind of gastric issues. Also very little bit of the fats and sugar.
So what you're trying to do is to educate people, and so that they don't go to the doctors, and so that we can all go out of business, right?
Yes, preventive.
Absolutely. I think it's very important. I think you bring a very important, pertinent point on drinking enough water, balancing it with a diet. So what are people come and ask me pre-surgery, post-surgery, what is a good diet? And I've also been confused whether to eat, rice or chapatis or wheat products, which will reduce weight. So I've been confused. So I used to mix match it and, try to avoid, skip my breakfast. What I found was that I actually put on weight. Then I realized actually saying like, hey, you know what? I'm giving advice to people. I need to actually understand and actually found that skipping breakfast is one of the most, it's a bad thing to do. What is your view on this?
Thanks for sharing your experience, because you've been quite open about it. And a lot of people advise one thing and then not follow another. And then for you to share your experience, I think it's a huge learning experience for all those who are watching. See, there are people who really need breakfast every day. And then right now, intermittent fasting, a lot are following that, right?
So Shiny, your internet.
When you understand what you need, what your body requires. Okay.
Okay.
You hear me now?
Keep going. Yeah.
So what happens is, when you skip breakfast, you end up filling the gaps with tea, coffee, a whole lot of biscuits. A lot of these are just coming until you eat the next meal. And this really affects cognition as well as the gastric health in a big way. Most people end up gaining weight because the first meal of the day becomes lunch, and they'll be ravenous and they end up eating quite a lot. Okay, but there are people who have fine-tuned themselves, are on intermittent fasting, and that works very well for them. So you kind of just need to understand the body type and then eat accordingly. That's what I would say.
It's important to have your breakfast. That's the important message we are telling people, because breakfast is because you're going to spend the entire day, doing your work, housework, home, going to office, or, if you're a sportsman, you're going to be playing. So you need fuel. If you don't put fuel into the engine, then you are going to have trouble, having energy for the rest of the day. Correct?
True. Absolutely. And one needs to eat breakfast as soon as you wake up, within the first 1 hour or 2 hours max, because a lot of people do not eat on time, and that becomes a big problem. So they really delay it. So try to eat breakfast as soon as possible, within 1 to 2 hours of waking up. That would help a great deal.
Okay. So so the next thing which we will talk about is, what about fast foods? Because children are always onto it, even adults are onto it because it's quick. We order food, and I think processed and fast food is actually not very good but it's easily available. So in a very busy lifestyle which we have, it's very difficult now that we're in lockdown. We're all become super chefs and Michelin chefs, and we're trying out all sorts of stuff again. When you do all this stuff, the fried and the fast food is because you can make it fast. You can just fry things and it comes easily. So what is your take on processed and fast foods?
Okay. Okay, see, the quality of oils that is being used by any of these catering establishments and all that is highly questionable. And and thankfully during lockdown, a lot of people are cooking at home and eating homemade food, and that is like a huge plus, and that has truly helped people regain, or rather get a grip over things as far as homemade food is concerned. Yeah. Okay, so the quality of oil used and reusing oil is really bad, and heating it too much beyond a particular smoking point is also bad, and that also affects health in a big way. Okay, and another most important factor is the trans fats or the hydrogenated fat. Now, the trans fats or hydrogenated fat is one thing which is of very poor quality, and this was developed for the baking industry or the bakery industry. So the buns and breads and rusk, all of that has these kind of, the butter biscuits, which is locally available in a tea shop.
Which we all love.
There's nothing but trans.
Nothing like a chai and a butter biscuit,
Exactly. Yeah, that's like so. And even in hospitals, if you go to hospital or wherever, so the canteen, what they have, though, the small samosas that we get, or the biscuits, all of that. So it's margarine or hydrogenated fat, and that causes a lot of damage to our system in a big way. And that's the root cause of a lot of health issues like acidity and all that. So I'm sure you see a whole lot of patients who come with acidity. Yeah. But is it acidity all the time, or it could be something else? Could you share what you face?
Yeah. So what you're saying is, whatever tastes good, whatever looks fried and yummy, is not good for you. That's what you're trying to tell us.
Not really. Healthy food can be tasty.
Yeah. I know. But this kind of oily, fast, okay, 3 o'clock, I'm going to have some chai, and a lot of fried food is not a great idea. So acidity and gas are some of the commonest symptoms which patients or friends, family call me for advice, because the problem is that I sometimes I don't mean is that they feel bloated. So when you feel bloated, that's because you're not digesting your food properly, you are not moving your bowels properly, and you had food which is which is still stuck there. It's because it could be the oils, it could be the ingredients which have been used. So that's the most commonest symptom which people come to. So acidity usually comes because, one, you're not eating on time. 1, 2, you're not eating the right food. 3, you are probably having a wrong balance in the food you're eating. So that all these things, and also the timing when you eat, because a lot of people, most of us work at different times, and work late, and traffic, and by the time we have food particularly in the evenings, it's about 9-10 p.m. in the evening, and then you just lie on the sofa and then watch some TV, or and then you just go to bed. Now the problem is, whatever you eat is not digested; it stays around, and and that's one of the reasons why you get into this kind of cycle. And again, if you don't skip your breakfast, there is lots of so the acid is secrete. So let's go back to digestion. When you eat food, the food goes to the food pipe, it comes into the stomach where there is acid secretion. So there's liters of acid produced every day to digest the food, right? And then the food is digested, broken down, then gets into the small intestine where it's acted upon by some more liquids from the the liver, the bile juices come in, and digestion takes place. And whatever is important is absorbed in the small intestine, and the waste material goes to the large intestine. Now the problem is, if for whatever reason you don't eat the right food, don't eat on time, the acid which is secreted, that keeps going by clockwork. So there's a lot of acid and there's not enough food, or the wrong food, and not eating on time. So that's where you develop acidity or gastritis, which is inflammation of the lining of the stomach. So once you develop that inflammation, now if you keep, again, this gets aggravated, but if you eat oily food, spicy food, fast food, and that's when it becomes a vicious problem. Now, the other thing is, if you're a smoker, bad thing, because the smoking will make the gastritis worse, and it's got a lot of other medical illnesses which get aggravated, but the smoking makes it worse. And again, alcohol again, will worsen the problem. So all these things act in one way or the other to worsen the problem. So that's what gastritis does. And unless so patients will come to me and say, sir, so do you exercise? They say like, yeah, rarely. Sometimes some of them do, but they have a very busy lifestyle, or party lifestyle, which we all do in this day and age. But then what happens is it becomes an aggravated cycle, or a vicious cycle, that this acidity and gastritis go hand in hand and makes it worse. So the important, and patients come and say, can I have a pill? And but they will not change their lifestyle. So I keep telling them, look, the medicines, the pills are for a temporary period, for a month or so, until you change your lifestyle. And this will only help you with getting back into a routine. But if you just take the pill and stop, and you just continue with your usual lifestyle, it will only get worse. So it is a very common problem, and gastritis can reflux to chronic gastritis, and given over a long period of time, it has been shown to be a precursor for gastric cancer. So, it's not something to panic, but bear in mind that you have to have a balance. So the important thing is to change your lifestyle, cut down on stop the smoking, very important. Cut down on your alcohol or stop it, and then eat on time, eat healthily. Maybe that answers some of the questions that you asked me.
Absolutely. Another thing that I wanted to highlight here is also not chewing enough. Okay, a lot of people do not chew their food well, and digestion starts right in the mouth.
Sorry, Shani.
You need to break down the food particles so that it can. Pardon? Yeah.
Your interview is, so I'm just saying, maybe we can cut your video, not that, just to stop the video, but the audio will go on. Shall we try that?
We could.
Can you hear me now? Hello?
Yes.
Has it
yes,
been
I can. I can hear you.
Okay, go ahead. Let's see if this is
better. So what I was trying to say, so what I was trying to say is that a lot of people do not chew well. Another thing is also the water intake. They do not drink adequate water, because most often if they're working in air-conditioned environment, that's another big issue. And also the food intolerances or food allergies. A lot of them are not aware that they could be having some kind of food intolerance, and unless you get it tested, one is not too sure that they have this kind of an issue. And if they continue to eat gluten or else lactose-rich foods, and in case they have these kind of problems, that develops as a lot of acidity and a lot of bloating, flatulence, and all of that results. So I've gone through this personally. 10-12 years back, I've had this issue, and I realized it was like I just had to stop the milk products and wheat and barley and a couple of other foodstuffs, and I became completely all right. So I feel rice and millets are the safest bet because it doesn't really have any kind of gluten, and it's part of the South Indian culture, and it's absolutely fine to use millets on a regular basis.
Excellent. Excellent. So you're a sports nutritionist. So tell me what a sports nutritionist does.
Okay, it's a very interesting field where they're actually helping an athlete improve their performance, and nutrition is one of the aspects that they really need to focus on. So it kind of really, it's very satisfying when you are part of their journey that they go ahead and clinch a title. So educating about what to eat, how should their hydration be, and we periodize the diet for a year. So it's not just during the competition, even the days leading up to the competition, and also what to eat during off season periods like now, because it's lockdown period and athletes are not able to go out and train. So we help them during this phase as well. And also when they travel quite a lot, like IPL and all that, they're literally living out of their suitcases, right? So even at that time, we teach them how to eat. So if they're partying, we tell them what to drink, what to eat. So every aspect of their nutrition is covered so that they're able to go ahead and achieve their fitness and wellness goals and also improve performance. It's fine tuning all these, which is
So do you advise the Chennai Super Kings?
No. There are individuals that I work with.
Yeah.
I'm not with CSK. No.
Okay.
But previously, yes, I worked with some of the cricketers who were part of the team. One or two of them. Yeah.
Okay. 1 minute. I'm just trying to see if we can get you back on video. Okay. So the next question I'm we're going to discuss is, when should people do exercise? What is a good time to do the exercise?
See, as far as one is exercising every day, any time is good. It's just that most of us do not do that as a regular routine. Just like how you wake up, brush your teeth, have a bath. I think there should be some form of exercise which will really help, because the incidence of non-communicable disease is increasing, and we are the diabetes capital. So with this kind of health issues, and also to reduce the incidence of cancer and other health issues, so it's best that you exercise. I would say morning, because you're done with it, because otherwise what happens is the day could bring in quite a lot of other things, and then at the end of the day, if you end up missing the workout, it's not a good idea. And some people, when they exercise later in the evening, the adrenaline kicks in, and that makes them quite alert and active, and they're not able to sleep well. So ideally, anytime before 5 p.m. or 6 p.m., if they could finish, great. But the best would be to do it first thing in the morning and be done with it for the day. And you start the entire day with a lot of energy, and then that's great. And you take that energy to your workplace, and that makes a huge difference.
So morning exercise is the best if you can. So suppose you miss it out, then you can do it later in the day.
Absolutely. Yeah.
Because I go to work very early, so often I use that as an excuse. But so if I miss it in the morning, I can do it in the evening, right?
Yes. And of course, in the hospital, you can always take the stairs, and then in your cabin, when there are no patients, perhaps you can do some 10 push-ups or do some squats. And there are people who practice yoga. So it's all about weaving in. If you take professional help, they guide you at every step, irrespective of where you are in the world. Yeah, you could do a lot of things by using elastic bands, investing in very small equipment.
In this lockdown, a lot of people are stuck at home. So what advice would you give? What sort of exercise can they do?
Yeah, Dr. Venki, I'm not a fitness expert, but I have a whole bunch of friends who are in the fitness industry. And so even, trying to test.
For example, you eat healthy, and you advise people on on sports and something basic. What should people do? How to keep themselves sort of active and.
Yeah, walking the terrace. That's what we've been doing as a family, and then climbing stairs every single day, and then trying to do some kind of stretches so that your muscles are not too tight. And also, of course, investing in maybe kettlebells, and then using elastic bands or elastic tubes. Those also help. So we've taken inputs from physiotherapists and fitness trainers, and that's keeping us going during lockdown. And there are so many Zoom classes. Our Zumba instructor has been having Zoom classes, and then there are fitness trainers who give personal training through Zoom. So, and then a whole lot of own body weight exercises. That's the best thing to do.
Yes, excellent. So let's move on to a very important topic, which is a huge problem, because I know I'm a colorectal surgeon, and although I don't deal directly with obese patient having a colorectal problem, the problem becomes doubly more difficult to treat, particularly colorectal cancer, and the risks and complications, everything increase. So, so I'm sure a lot of people will come to you and advise for obesity. And what are the challenges you see? And do you think it's a big problem in the Chennai city too, and around the country?
Absolutely, absolutely. So the biggest thing is, years ago, see, out of the 20 years of my work experience, 12 years I worked in fitness studios, fitness centers, because that's where my athletes would come on a daily basis. Like, I hardly used to see them in hospitals, but it made sense for me to sit in a fitness center and take care of their professional requirements. So what I noticed was insulin resistance. So they would be exercising, they would be common people, not necessarily athletes, non-athletes would work out 2 hours in the morning, 2 hours in the evening, and still they wouldn't lose weight. And later, when we do the blood work, we realize they could probably be having some hormonal issues. And what stood out most of the time was insulin resistance. So their fasting and postprandial insulin levels would be high, but if you notice that their HbA1c would look absolutely normal. So, and most often, unless an endocrinologist intervenes or probably a dermatologist, they wouldn't have checked their insulin hormone. And the incidence is so high across the country, as well as, of course, in our city. Okay, so that is one of the biggest problem why they need to focus on the diet. So usually a low carbohydrate diet is given, and also intermittent fasting helps a lot. And weight training makes a huge difference. So cardiovascular fitness plus weight training, or cardiovascular fitness plus yoga. So both of this can really work, because not many clients like to go to the gym. There is a cluster which doesn't want to step inside a fitness center, and they could still go ahead and do yoga. And yoga works on the neuroendocrine system. So any hormone related stuff, results are excellent when they do this along with a healthy diet. So I would say 80% is the food, 20% on toning and exercising, and of course sleeping on time.
I think, yeah, absolutely. I think sleeping makes a huge difference. Because to be very honest, because of the work as a surgeon, and our training periods are very long, I've always had trouble sleeping for 8 to 9 hours. So I sleep for about 5 hours, 6 hours, and I got used to it. But in this lockdown period, it's a bit more organized, because we're not rushing. So I see that my weight has come down from 3-4 kilos. It's come down just sleeping on time, eating at home, avoiding fast food. It's fascinating, So we don't have to break our heads on saying why we're not losing. It's all boils down to having a routine, because it's very challenging in these times, running, to get children ready to go to work, do all sorts of commitments we have. But I think sleep is, as you rightly pointed out, is very important. I think 7 to 8 hours of sleep is very, very important. And I think if you sleep well on time in a routine, I think you'll automatically lose weight, and that's what the evidence shows. Also, what we're seeing is in this COVID situation, if you look at the people who are suffering or getting into difficulties, most of them have comorbidities, and one of the important comorbidities is being overweight or obesity. So having a fitness regimen, having a good diet is so very important now. And I think I don't know about colorectal surgery, but I think nutrition and dietitians and fitness gurus are going to be the future of mankind, I think. Because once if you stay fit, then you're not going to get into these problems. And even if another pandemic comes in, at least you won't be in that high risk group. So what is your view on that?
Yeah, absolutely. To that list, I would like to add even therapists and clinical psychologists.
Absolutely, absolutely.
Because I think mental disease is another huge problem. And compliance to any kind of workout regimen, or perhaps even following a diet as such, or healthy eating. Consistency is the biggest challenge that I face when it comes to dealing with clients. Either the expectations are way too much, like trying to lose around 10 kgs in 1 month, or not able to resist certain foodstuffs which they are very fond of, or not able to give up certain foodstuffs that they're allergic to. So I think that's when the psychologist or the therapist comes in. So I always work with a team.
Yeah.
And that's when the results are much better. Dr. Venki, I have a question for you, because a lot of people who try to lose weight, someone who's morbidly obese with a BMI about 27.5 and above. And when they shed weight, the gallstones is a huge problem that we see. What are your thoughts on that? Because we know that they're going ahead and losing a lot of weight. That's great. But so what are the symptoms?
So a lot of these people,
I wanted to ask.
Yeah, based on their dietary changes and, and their comorbidities. So when the symptoms of gallstone, and that's what it's been described if you look at the textbooks, but the classic symptoms of gallstones are, sort of acidity symptoms, most important, discomfort in the upper abdomen, pain in the right upper quadrant, where the gallbladder is just below the liver. So that, and the problem is the symptoms are very similar to gastritis, because they feel bloating, they feel as if there is a catch in the chest, and typically what is described is when you get these symptoms get aggravated when you eat oily, fatty, cheesy food. So those are the classic symptoms. So when patients usually come to me, what I try to do is to put them on, obviously look at the aggravating factors. If they're a smoker, alcohol, oily, fast food, we try to cut them down or advise them to cut them down. And then the next thing is to put them on some medicines which will reduce the acid. Now, at that point in time, depending how long the history is, I also, if it's more than a few months, then I ask them to get an ultrasound scan. If you do an ultrasound scan, that's the best test to pick up gallstones. So if they pick up gallstones, then we still put them on the acidity medication for a month. And even after the medication, if the symptoms don't settle, then most likely the symptoms are usually due to the gallstones. Then you have to treat the gallstone. If sometimes you find gallstones which are asymptomatic, you do other tests and you find gallstones. So if you find asymptomatic gallstones, it's funny, colorectal surgeon talking about gallstones, but it's a common problem which I come across in daily practice, and we have a team, Dr. Sudeep and Dr. Asu, who work with me, who deal with it. But so if you have a gallstones which are picked as a when you do other tests and they are when we call them asymptomatic gallstones, the chance of them causing trouble is 5%. So normally, if they're small, less than 5 millimeters, we just leave them alone. Is small in size. If they start to grow in size, and we can do it if they have caused symptoms, or if a patient has got asymptomatic gallstones but got diabetes, then we recommend that they have the gallbladder removed through keyhole surgery. That is the standard of care. I know a lot of people in India will go for medications, but that's not the standard of care around the world. If you have gallstones which is symptomatic, or in a high-risk group like diabetics, then you have to have a laparoscopic cholecystectomy, keyhole gallbladder removal.
Okay, that's really so. I think I have another question for you. So obesity, that very interesting topic. So as they reduce the fat percentage, the risk for cancer. See, there is a connection, I'm sure, with the colorectal cancers as well. That's one thing that I've been just waiting to ask you.
Obesity.
The of body fat connection with.
So obesity increases the risk of colorectal cancer, as with many other diseases. As we've seen in the COVID scenario as well. So the issues with obesity are there's interlinking to coronary artery disease or ischemic heart disease,
PCOS, infertility.
Yeah, all of these are interconnected. So if you're supposed to have colorectal cancer and you need to have major surgery, although we've reduced the surgical risk by standardizing the operation and doing robotic surgery. So patients are in only 3 to 4 days, but still it is major surgery. So when you have to go through major surgery and you're obese, and particularly doing open surgery will be because you need a big cut. It becomes then if you're doing open surgery, for example, when you put a big cut, then post-operation it becomes very difficult to breathe. So you develop infections in the lung, and also wound healing could be a problem. Obesity is linked to bad wound healing, and also with diabetes and ischemic heart disease in the background, your risk of complications goes up. So it is just a no-brainer now, given that obesity complicates a lot of disease patterns and diseases and aggravates your risk of falling ill when you have COVID-19 or another pandemic in the future. So I think it becomes very imperative that we all take health and fitness seriously and try to get into a better diet and better fitness.
Absolutely. Yeah, I think those are great takeaways. Yes.
Can I ask you a question?
Yeah, go ahead.
So, a lot of people are now moving from, non-vegetarian to vegetarian. Veganism is becoming very popular. So, and I think, if you actually look at it, I always thought, how can you have a meal without meat or fish? But when you actually look into it and you go into vegan restaurants or people who have a vegan diet, actually you can cook lots of healthy, nutritious, food which you really taste, which tastes so nice and also you enjoy. So, what is your advice? Where can people start, if they want to go become vegan? Because I think it's a good thing for the future. We have to cut down on the amount of meat we eat, not only because it is healthy, but also on the environment. The meat or the animal husbandry industry is one of the biggest polluters in the world. As much as we like our meat, it's one of the biggest polluters in the world. The environment gets, not to use the word screwed, gets decimated because of our love for meat. And, as much as I love it, and I'm going to make a pledge to eat less meat. It's going to be hard. It's going to be difficult, but at least to cut down on how much I eat. So, because I know my good friend Shakti Girish would jump up in joy because, she is a, pro-vegan and I think pro-animal, lover. And I think we all need to be in that group because it is good for us. So where would people start? Should people start if they want to convert?
Yeah, great question. Yeah, I know. See, ever since that Netflix documentary came last September in, the Game Changers, there's been a whole lot of debate about should one become vegan, even in my industry, athletes, because it also talks about a whole lot of performance enhancement and all that. It's a very, an area where there's quite a lot of debate going on, okay? What I would say is at least limited to, say, just few days in a week and not every day. If you're really trying to make that transition. And if you already have lactose intolerance, it's best to avoid any kind of dairy products, okay? Because I've seen great improvements when somebody has uncontrolled diabetes, as well as PCOS, infertility issues, or autoimmune issues like lichen planus, or it could be alopecia, or it could be psoriasis. When dairy is removed, the results are fabulous. Okay, so there are a whole lot of benefits out of that. So it'll be good to make that shift. First, remove all the dairy products, and then gradually next thing will be to limit meat consumption to probably just over the weekend, or maybe one weekend and then somewhere midweek, so twice a week for one meal, and then gradually increase the vegetables. See, every adult is supposed to eat around half a kg of vegetables a day. Are we eating that? Is the big question. Next thing is we're supposed to have 3 to 5 fruits a day, and also bring in a whole lot of colorful fruits and vegetables. So when we are not doing that, the basic idea should be to start eating seasonal fruits. So right now, mangoes, jackfruit, papayas, all that is available. So start eating what's available locally and then build on it. Bring in 5 different fruits in a day and then start eating, add some vegetables to your breakfast, a cup of sprout salad, or probably add some vegetables to the omelette and then or to the dosa. Or the chutneys could be made out of some
I
herbs
love
like,
my dosa.
mint.
I love my dosa. I love my podi dosa.
Oh, okay. Try having kheera dosa and have Spanish omelette.
Yeah.
Yeah, so these are interesting ways to incorporate, right? So kheera dosa is good. Then pudina kothumali chutney is good. Then what else? You can add a whole lot of vegetables to uttapam, to the idlis. So that's a fun way of adding vegetables and slowly build. And lunch. So your kheera, kootu, the vegetable biryani or the pulao, the raita that we eat, slowly increase the quantity there. Pasta, noodles, add 50% of vegetables there. Add a little bit of chicken, say 20% of non-veg, minced meat or chicken, and then 50% of vegetables, and the rest could be the pasta or noodle. So that's a fun way of including a lot of vegetables, and you build on it and reach a point of eating 500 grams of vegetables a day and 5 fruits a day, and then including lentils. Sundal is a great snack. So instead of a bhaji bonda mixture, murukku, tatte, pani puri, the best would be to eat some sundal and maybe the patani sundal which we get in Marina Beach, make it at home
Yeah.
or a bale puri at home. So then you get a lot of vegetables. That's interesting.
So anything which is fried.
That's how you could make.
Yeah, anything which is fried hard is not good. That's what the simple thing which I'm trying to get out of this. So whatever,
Yeah.
there's lots of mix and matching, lots of these, what's that store in Ananaga called Danium or something like that. Those stores will have all these different, lentils and dals which you can mix and match. And I think because once you change your diet and into a healthy one, you would so what I find, one of the commonest things which people come to me to my clinic is constipation, because constipation is a very, very common problem, because what it means is that your stools are hard and you're finding it difficult to evacuate. So as going back to the process of when you eat food, you goes through the food pipe, gets digested in the stomach, important things get to the small intestine, the nutrients are absorbed, the waste material comes to the colon. So as you rightly said, we need to take 3 liters of water, which is very important, because what the water does, it gives that, the softness to the stool. So if you don't drink enough water, the body needs that, that amount of water to, to stay hydrated. It is going to absorb whatever water content is there, and what it makes your stool even more harder. And then if you eat a lot of meat and less, balanced diet, then this stool is going to get even more harder, and it becomes, that's when we say you have constipation, and then you're not evacuating. So those are the precursor problems for complications or problems with around your anus, most commonly hemorrhoids or piles or an anal fissure. So, people ask me if constipation directly causes cancer. It doesn't. But if you have a blockage, a cancer develops due to all sorts of reasons, which will look at bad diet, family history, smoking, alcohol, all these things. If you develop a cancer, it creates a blockage, then you will get constipation. So it's not the other way around. So, but constipation, what will happen is, because your stool is hard, you strain in the toilet. So when you strain, you put pressure because you want to push this hard stool, out. That's when the cushions around your anus, these are the hemorrhoidal cushions, they become to swell up and come out. These hemorrhoidal cushions are blood vessels, and then when they start to swell up, they bleed because they're very friable. And that's what painless rectal bleeding is, a classic symptom of hemorrhoids. And if you look into the history, usually there's a hard bowel movement, which is aggravated over the years, usually in college or or recently. And when this progresses, this cushions slowly start from degree 1 inside, degree 2 slowly coming out, and when it's completely out, it's grade 4. So that's what a hemorrhoid, and usually because of constipation. And again, so painless rectal bleeding is hemorrhoids, usually with the background of constipation, or if you have pain when you go to the toilet, this is the most common symptom people come to me with, or when you have a hard motion which makes a cut around the anal edge, which is an anal fissure. So it's a nice, it's a sensitive area which makes a fissure. And so patients complain of a very severe pain, like a knife being stabbed in your anus, or in a ground glass put around the anus, which is a very classic symptom, and drops of blood. So in hemorrhoid, you get a splash in the pan, which is painless. In fissure, which is a tear, you get pain. So, but the precursor is constipation or hemorrhoid. So you can easily avoid this lifestyle change. Lots of water, balanced diet has been talking about. Okay, guys.
Also,
Yeah.
polished rice.
Yes. Sorry?
I said whole grains also will be really good. Sorry for interrupting, because a lot of people eat only white rice.
I love the red rice they eat in Kerala. It's great. That's very healthy, isn't it?
Absolutely. Yes, it has a lot more fiber than the white.
Yeah, so that's good. So guys, please send in all your messages on the chat box. We will try to answer that after the session, so that we spend enough time individually answering your questions. So coming back to this question about, we're talking about constipation. So those are the two main issues which cause fistula. Is different. We won't discuss it now. So if you drink enough water, and so again, a lot of people will come, people who are in fitness and sports people who sweat a lot, and they think, okay, 3 liters is enough, but it's not, because you're sweating a lot. You need to compensate for that. You may need 4 or 5 liters of water. So you need to know how much you are drinking, and also, so you need to measure. I would suggest that you have a bottle like this, a 500 ml bottle, or a 1 liter bottle, and measure how much you drink. It's very important. And also watch the diet you take, because as we've been talking, all this is interconnected. You are what you eat. It's a very important message to take home. Would you agree on that, Shiny?
Absolutely, because you can prevent disease in a big way. With lockdown, economy being hit, and a whole lot of other things, you don't want stress about health. And I think we all need to protect our families, and the best way would be to just address the basics. Sleep on time, drink adequate water, sit at the dining table, not in front of the television, chew your food well, okay? And you don't want the kind of stress, because when you watch television and then you watch all those debates, and that's a lot of gastric juices that's going to secrete, and the acidity and all that is going to follow. So the best is to sit in a calm, relaxed atmosphere, spend time with the family, chew your food well and eat a healthy, balanced diet with a whole lot of fiber, soluble and insoluble fiber. And I think life is sorted pretty much. Yes. I wanted to ask you about IBS. Because Dr. Venki, a lot of my clients of late, because of the stress that they're going through, some have anxiety issues, some have depression. Since March, I've seen that, IBS, usually what nutritionists do, dietitians do, is give a FODMAPs diet, because there are specified diets that's given for people with IBS. And a lot of them are not aware as well. So from your side, if you could tell, what are the triggers? Because as far as diet is concerned, we limit the intake of certain fruits, then dals like rajma, chana, which are quite hard to digest. Okay, and also whole grains. So it's a mix and match, a combination, trial and error, because theory says one and the practical is all together. So we see how much they can tolerate, and then keep working with them. So from your perspective, yes, if you could.
So IBS is a common problem, because particularly it affects the younger generation. IBS is different from IBD. IBS is irritable bowel syndrome. IBD is irritable bowel disease. IBD, just to briefly, is ulcerative colitis and Crohn's disease. These are inflammation of the gastrointestinal tract. Crohn's disease affects mouth to anus, any part of the gut, and ulcerative colitis primarily affects the colon. So that is a different entity. Irritable bowel syndrome actually is equally challenging condition, because it's very common. Most commonly, the reason we don't know the cause. That's whatever we don't know, we put it at IBS. So what I mean is that it is basically, there is no organic problem, but more to it's a diagnosis by exclusion. So we do all the tests, gastroscopy, all endoscopy, allergic tests and all that, and all of them are negative. And then they label somebody as somebody's got IBS. So what it means is that your gut is very sensitive. That's what I understand, or why I tell my patients that you're a nice person and you're a very sensitive person, and so is your gut. So you like to be taken care of and looked after. Similarly, look after your gut. So how do you look after your gut and avoid having aggravations of IBS are? So basically, commonest thing is stress, as you rightly pointed out, which is very, very common, particularly in people who do different shifts, which I see, because we have a big IT sector. Hopefully, we'll all get back to work soon. But in Chennai, and people who are busy running around, and so stress is an important one. People who have a different work pattern, who work late night shifts, early morning shifts, who have this sleep pattern disturbed and food pattern disturbed, they seem to have a lot of IBS type of symptoms. People who eat fast food, processed food, have a lot of these IBS type symptoms. So your gut is very sensitive. That's what I tell my patients. So you need to eat what you eat and watch what you eat. You can't try all these fancy food which can, because all the processed food can have all ingredients which can aggravate the gut. And also an important thing is to drink lots of water, exercise. So it's all, so if you look at it, it all boils down to what we've been talking: enough water, enough sleep, healthy diet, eating on time. These are all basic things. And if people are going to follow these things, then we guys are going to be out of work, which is great, because at the end of the day, we'll find something else to do. Maybe we'll just be internet advisors, and become gurus, motivation gurus. I don't know, but I think people have to stay healthy, and we are here to educate them or give them the advice. So going back to that IBS thing, it's very important that you understand that what you eat, drink, the stress, all that is aggravated. So eating and drinking, you can change. The stress is the challenge, because there are a lot of things which can aggravate or make you stressed. It could be your work, it could be your your finances, it could be your family, it could be your parents, it could be your wife, husband, brother, sister, children, everything. So you can't get rid of them. Obviously, don't do it. Be nice to them. So you have to modify, because it may be something which is aggravating, with the person. It may be a friend, it may be family. You just need to modify. The simplest to modify our behavior. I find that, and then I realize it's actually my behavior which is aggravated people. So usually I find that when I calm myself down, and the problem gets better. So I would suggest that modifying our behavior, and also that will help people modify their behavior. So so those are the challenges. Drinking enough water, diet, and all that can be changed. But the stresses are the ones. You may have a challenging boss, you may have a challenging colleague. Those are difficult. You may have a stressful job. So these are all, and particularly in this lockdown period where we have lots of challenges to looking into the future. It all looks a bit gloomy, but I promise you, it will get better. I keep telling people, I've seen lots of challenges. There's lots to see as well, but whatever I've seen, we have to stay positive in all these things. And, and I think if you stay positive, most of the stresses will come down. It will be a completely different thing next day or tomorrow. So the important thing is to keep your mind healthy, exercise, drink lots of water, watch what you eat. And I think most of these IBS symptoms can be under control. There are some medications which we can give. And, there are some IBS which are more constipation, some IBS which is more diarrhea. So we have medications which can help, but we can talk about that another time. But those are the simplest things simple things. So we are almost another 10 minutes to go.
Yeah.
Your quick take on yoga and alternative therapies like, Ayurveda, Siddha, and all those things.
Yeah. Because yes, I do refer clients to some of the Ayurvedic physicians or Siddha practitioners and a lot of yoga teachers, because a lot of people, as you mentioned, they need to handle their stress positively. The situations don't change, but our attitude, our response to situation is what is very important. And yoga really calms the mind. And a lot of hormonal issues, as well as hypertension, high blood pressure, and as well as uncontrolled diabetes, has come under control after they do yoga for a sustained period of time under the guidance of a professional. So you just have to approach the right professional, and I think they can sort out quite a lot of stuff. And we also see a lot of improvement in their diet. And then since their mind is so very calm and they're more receptive to ideas, they don't have this unnecessary chatter, and they're able to take up exercise and stay very committed, and it becomes a lifestyle change. And so that way yoga is something that I truly believe and recommend it to a lot of my clients, and Ayurveda, Siddha as well, but not to combine allopathic medicine and then an Ayurvedic treatment together. I say if you take one school of thought, go to the right person and stick to them and work with them for, like, a good period of time before you just say, hey, this doesn't seem to be working for me. So it's all about that. Yeah. And you summed it up beautifully about the diet and all these aspects about anxiety, stress, and all of that. So simple things about diet, I would say, is if you know what to eat, when to eat, how much to eat, how often to you eat, you're sorted for life. So these are the simple takeaways.
So when people ask me, can we try different, Ayurveda for constant? I tell them, look, Ayurveda and Siddha, they've been around for thousands of years. English medicine has been around for a few hundred years. So please go try it, but keep a time period, 3-4 weeks, try it. If things don't get better, then come back to us. We'll work on a different model. And then if things don't settle, then we'll test you out. So there are two important questions which are coming out. One from Mickey Watwani, my good friend, on probiotics. So, and also from Lakshmi Priya on gut microbiome. So they're all interconnect. So just to, there is, in your gut, there is bacteria. They live inside your gut, and there are good bacteria and bad bacteria. So bacteria are very important for a healthy living. If you actually look at some of the new research, or it's been around for some time, if you have inflammation of the gut in a particular inflammatory bowel disease, we've been trying to do a fecal transplant. That is putting someone else's stool into your gut. As crazy as it may sound, but what is in your stool or fecal feces is bacteria, right? And they have been colonizing your gut for from time immemorial. We've grown with it, they've evolved with that. So we need a right balance of good and bad bacteria which maintain a balance in your gut health. So when this balance is altered is when you get without going into too much detail or science behind it. So you need to just have a right balance. So if you take too many antibiotics, you just wipe out these bacteria. That's why taking bacteria and antibiotics is blindly is a bad idea, because you just suppress your immune, particularly in this environment where there is a pandemic going on. Try to be very careful in just popping antibiotics, because you reduce the immunity, and also you will kill some of the healthy bacteria which protect you, or the gut lining, and so it's important to maintain this. So, a very good questions were asked by my friends. So the probiotics are these things which, which are, sold.
Curd also.
Yogurt and things which they contain these bacteria, and capsules as well, which give you a dose of these things at a very low level, so that they sort of regenerate or augment this community. So they are pretty safe, and it's been shown to sort of generally improve wellness. So I think it's a reasonable thing to take. It's not going to cause you any harm. But is it a solution or an alternative to eating healthy, being sensible, of what you eat, a healthy diet? It's all in your diet. So when people come to me saying, Doc, normally they get very upset when I give them like one tablet or say, look, go change your diet. They're like, look, I paid you good money for a good consultation, and you're telling me, drink lots of water, eat well, exercise. I know that. And I said, like, then why are you not practicing that? Because that's the basis of your good health. Whatever medication I'm going to give you is to just a bridge to get your acute symptoms down. But, so I normally have a 15, 20-minute chat, and they go like, oh, where's the medicine, man? I go like, there's no medicine. The medicine is all what I've told you. You have to change. Most of these things are all lifestyle related. So we're almost out of time. And so, Shiny, so let's agree on some mantras. So good sleep, right?
Good sleep, definitely.
6 to 7 hours a day?
Yeah, it's about the time. Going to bed at 10 and waking up at 6. No binge watching Netflix, Amazon Prime.
And your phone, because I do it. What is check my phone before I go to sleep, or when I wake up in the middle of the night for something, I just check my phone. I think that's a bad habit. I'm guilty as well. So no phone, at least for 15, 20 minutes, half an hour before going to bed, and 6 to 7 hours of sleep. And then water, at least 3 to 3 liters. Yeah,
3 liters. Yes.
And if you're exercising or doing lots of fitness, you need to add more water. Healthy diet, more
fermented food, so that they get probiotics. So the Parayasadam or the fermented rice with water.
Yeah.
And the Kambakulu, Ragi Kulu, all that is there. It's all fermented. Idli dosa is fermented.
So we were having this before the Facebook Live about intermittent fasting. This is all our forefathers have had lots of things about this Parayasadam. Not that they couldn't afford proper freshly cooked food, but it had all the probiotics, natural probiotics in it, and and there's a reason for it. So please do not discard what our forefathers are now old and people in the villages who still practice these things, which we guys in the city have ignored. They are very, and this intermittent fasting, like they say, basically you eat once and then you fast so that you rest your gut. And doing that once in 2 weeks or once a week is a very good thing, because it gives you time for the gut to sort of recover, get the toxins out, you hydrate yourself with water. So, so sort of colon cleansing, and people have asked me about colon cleansing. There's no scientific evidence, but there is evidence to suggest that if you do, rest your gut, that, that gives time for the gut to recover and sort of expel all the toxins. So that's good. So good diet, avoiding processed fizzy drinks is very good.
Yeah. Avoiding processed fizzy drinks, bad fats, that is all the hydrogenated fat or reheating oils, and any colors, additives, chemicals which are added to the food is best avoided.
Yeah, and to finish off, exercise, which is so important. Shani said first thing in the morning is good because it gets all your adrenaline flowing, it gets your body in the right shape and mind. And if you can do that in the morning, ideal, so that you'll have a great day. Obviously, it will help you with keeping fit, losing weight, and your digestion is much better. And then that will, reduce your risk of having ischemic heart disease, diabetes, and all other risk factors which brings along. Great. So I think we are all done. Thanks for your sharing your views. It's great to have you on the show. Hopefully, we'll bring you back in a few months, and we can look at a different angle on health and fitness. Thank you.
Sure. Thank you for having me here on your show. Amazing, fantastic session. I had a great time being here.
Okay. See you soon. Bye bye.